Hello everyone, this is Dr. Vinash. Today we'll be seeing a case of omental abscess which we have taken up for exploration using laparoscopic surgery. Now here you can see this omental mass is densely adherent to the anterior abdominal wall. Now we were trying to separate the mass from the wall, and considerable amount of force was required to do the adhesiolysis. Now, this case was operated 2 months prior at another hospital, and after that, the patient slowly gives history of progressive pain with development of a mass for abdomen. Now, here, as we were trying to separate the omentum, you could see that that is probably a stitch. We are not very sure how that stitch was protruding from the anterior abdominal wall, and probably it entrapped some amount of omentum too. We were finding it really difficult to proceed with our dissection. At this point, you can see we are trying to use the suction and trying to separate the omentum from the anterior abdominal wall. So here, as we continued with our dissection, we had to apply a considerable amount of force to try to separate this omentum from the wall. Now we could have used bipolar energy or ultrasonic energy at this point, but in the preoperative CT, the bowel was very close to the anterior abdominal wall, and if there would have been any collateral thermal damage, it would likely go unnoticed in this inflammation. So we have decided to open up the patient, and here, after dissecting the omentum from the sigmoid colon, we get this picture. Now, upon first glance, we thought that this might be a tumor which has perforated, followed by formation of a omental mass and a omental adhesion. Now, to thoroughly evaluate the lesion, what we did was we went in with a colonoscope, and the area, the luminal area at the region of this mass was completely free of any pathology. There was no tumor, there was no redness, and the mucosa was completely fine. So we concluded that this was an inflammatory pathology which most probably resulted from a colonic injury. The etiology could be iatrogenic, we are not completely sure of that. Here you can see this is the opposite side of the omentum after excision of the omental mass. We left a drain, and the patient did very well postoperatively. The drain was removed on the 7th postoperative day, and the patient is doing completely fine. Thank you.